So welcome. As I mentioned before, my name is Bill Campos. I'm the CEO of ICLA. Just to give you some context about ICLA, we are a specialist psychosocial disability and complex mental health service provider. Um, we do, and oh, there we go. I'm hoping that people can see this. So we are presenting this webinar, obviously, with the reflection of the services that we provide. Um, Well, ICLA has been around for or close to 40 years now. We started as just originally as a homelessness sector or as homelessness service. Through the last 40 years, we've evolved to become very much focused on supporting people with psychosocial disability and complex mental health. We currently deliver about 8 different services across the mental health, housing, aged care, and disability. So there is a number of people, a number of services that we provide support. Our catch, and we also deliver services online. Here is a website. I encourage you at the end of this presentation to go through and understand a little bit about the services we provide. We are potentially looking at also expanding some services, which we'll talk about at the end of the presentations. In terms of the agenda, I'm happy to start going through and presenting. To context, we wanted to make a presentation around 3 levels of context, I guess. We've invited Jennifer Smith-Mary to talk a little bit about the kind of the meso areas associated with understanding people with psychosocial disability. So that's understanding the kind of research, the policy procedures, and some of the key areas associated with how reform is taking place in this section, in this area. So Jennifer will talk to that, and I'll introduce her in a minute. We also invited Evelyne Tadros, who's the CEO of the Mental Health Coordinating Council. She obviously represents this sector with a membership base around New South Wales for services or programs and organisations that deliver mental health services. In this context, we were wanting to get a viewpoint or a perspective around how the sector is adapting and changing to these reforms, and in particular, what are some of the representations associated with program delivery that can address some of those foundational changes that we all talk through as well. And lastly, but importantly, we have Jackie Hatswell, who's one of our parent and carer advocates. She's been working with ICLA for quite some time now and been a strong advocate for the sector. And this is an important perspective to understand how reforms and how changes and how service delivery happens. But on the ground, how does it really translate for the parent and the carers and the people we support? So we'll have Jackie to talk about that perspective. So without further ado, what I would like to do is introduce Jen. I hope that Jen, you're there. We are hoping to swap some slides that I'll do that while I introduce. So Jennifer Smith-Mary, if you're there, I'm happy for you to start.
Okay, I'm showing, I'm able to even share my screen now.
Yeah, perfect.
So apologies for that. We'll be able to move on. So what I'm going to talk to you today about today is that some work that we've been doing on unmet needs, navigator type roles that include support coordination and recovery coaching, but also the new navigator roles that have been suggested under the NDIS review. And I'm going to then talk about a little bit about foundational supports and the role of navigators within foundational supports and the model that we've developed. I'm not going to go into big detail about our foundational supports model and because there's not enough time, but I will provide you a link to an upcoming webinar that we have on foundational supports. So for those of you who don't know me, I'm Jen Smith-Mary from the University of Sydney. I'm here on the lands of the Gundungurra and Darug people up in sunny and windy Katoomba, and I'd like to acknowledge those traditional lands before I start. I've already said what I'm going to talk about today. I'm going to just tell you that I think that much of Australian health and social policy is failing people with serious mental illness. And that's because we're not offering everyone the support that they need. So we're only offering support to particular groups of people with mental health challenges. We're not offering people offering universal support that people need. Under the United Nations Convention on the Rights of People with Disability, which underpins all of our mental health policy in Australia, or should underpin all of our mental health policy and all of our disability policy, people should have the same rights to accessing support no matter what disability they have. So it shouldn't matter what type of disability you have, and it shouldn't matter how permanent your disability is, and it shouldn't matter how you received your disability. So it says that individuals need equal participation and inclusion, no matter what their disability is. Australia has signed and ratified that convention, so it is meant to apply to all of our disability supports in Australia. But what we found is that people with disability relating to mental illness are not getting the same supports as other people with disability, and they're not getting the supports that they're not getting equal supports across different systems as well. So my research is trying to develop better psychosocial supports for serious mental illness, and I acknowledge that the language there is not universally approved language. So we're moving to thinking more about mental health challenges and the functional impairments related to those challenges being serious. So we're in the process of changing some of the language that we're using in response to discussion in the sector. We've completed a lot of research so far. So this is a well-funded project from the federal government's Australian Research Council, and that's a competitive grant scheme. The NDIA is a partner on that grant, but they are not involved in the outputs that we have that we're putting together. So what they do is they provide access to the systems that they collect information on about participants, and they advertise our call for participants. And then we provide information that we think is going to improve the scheme. And that's a really good outcome for us because we want to try and improve the NDIS, and having that direct bridge into the NDIA is important to that. So just quickly, you probably already know this, but who are we talking about? Well, there's about 5.5 million people with disability in Australia, and that includes 3.2 million under 65. And based on the National Survey of Mental Health and Wellbeing, the most recent survey, 8.5 million had experienced a mental illness at some time in their life. 4.3 million had experienced a mental illness in the previous 12 months. Around 3% had a severe mental illness, of which 330,000 people have episodic mental illness and 170,000 have persistent mental illness. Other governments estimates put the figure at 686,000. The NDIS is, in comparison, only supports just under 70,000 people. So there's a big gap there in support. What we try to think about is the difference between some of these terminologies. So psychosocial disability is more about the disability that's arising from severe mental health challenges. One of the issues that we are trying to address is this gap outside of the NDIS. And what is outside the NDIS really does not meet people's needs. And that's been well documented over a very, very long time. So back in, more than 10 years ago, the Federal Department of Health and Ageing was talking about the need to implement supports that were going to address the really fragmented and chaotic approach to mental health support in Australia. Existing national programs outside the NDIS, such as Better Access, don't effectively target people with significant functional impairments from mental health challenges, and previous programs that worked were defunded to pay for the NDIS, such as Partners in Recovery or FAMS. But the people who received support from those programs didn't necessarily make it into the NDIS. And what it meant was that group of people were not serviced well after the introduction of the NDIS. The NDIS was also never meant to meet the needs of everyone. And that's, but there was an assumption when it came in that it would do the work of supporting all people with disability when really it hasn't. And there's also been a sort of a national failure at state and federal and territory governments to increase the funding for psychosocial services, which really there's been actually as a percentage of our expenditure, the service support for mental ill health has not really changed over a very long period since 1992, despite repeated calls and about the problems that are facing the sector. This graph here shows you that there's been a real drop-off in the number of people with who are applying under the psychosocial disability as their primary disability into the NDIS. But there hasn't been a similar drop-off for other participant groups. So you'll see in the orange bars, that's the rate from sort of the bottom is the top is the most recent. Actually, there's probably another bar there as well that shows it's around about 23% eligibility rate. And that means that only 23% of people with who are applying under psychosocial disability get access to the scheme, whereas for all participants, it's around 81%. So we haven't seen a drop-off overall, but we've seen a significant drop-off in eligibility for people applying to the NDIS under that disability type. Now, what is this telling us? It might be telling us that there are problems within the NDIS in terms of how applications are being assessed, but it's also telling us that people are becoming increasingly desperate for supports outside of the NDIS. And that while they might not be eligible for the NDIS, they're needing supports and they're going through the effort of putting in applications. We conducted a survey of over 1,600 people, and we looked at people who were not receiving the NDIS and found that there was significant need amongst that group. So around two-thirds of people said that they were not having their needs met by existing services. And the most frequently unmet needs were in relation to accessing healthcare and therapies, getting out of the house to do activities, and improving relationships with family or friends. And people who we also had open-ended responses, so people could use their own words to talk about their needs. And they were talking about the need for psychological supports, which provided therapies, counselling, illness self-management, and emotional regulation. And part of that is because the NDIS does not fund psychology, but better access, which is meant to fund psychology through Medicare, is not really meeting demand because of either the gap fee or just not enough better access psychologists. Other things were psychosocial support for personal recovery and independence, daily living supports, financial and employment supports, and involvement in community and social activities. The most common reason for people not accessing supports were the cost of supports, not knowing what supports were actually available, a poor understanding of how the system works, and long wait times. So you'll see that two of these are about understanding and navigating the system. So in having their needs met, people really want relationships with a key person who can help them to meet their recovery goals and link them to services. So in the NDIS, we've got those roles already. They're support coordinators and recovery coaches, which a lot of people in this webinar will be aware of. The review also recommended another role is introduced, psychosocial recovery navigators. Our research has found that both support coordinators and recovery coaches are seen as really important to the effective operation of the NDIS for people who receive it. And the literature shows that these roles are really effective where they're done really well. However, the delivery and coordination and coaching under these roles, it has not universally lived up to expectations. And so examples are where people have a support coordinator that lives a very long way away from them, so doesn't understand their local context. Support coordinators who just don't understand mental health and recovery principles. They don't understand the sort of ways that you work with people with psychosocial disability. But the system says, okay, well, maybe we can address this. So when we talk about in interviews, maybe we can address this through the new psychosocial navigator role. But we're concerned about that because when we look at the reasons why support coordination and recovery coaching is not working, it's limited by things that are often systemic. So a lack of role clarities from the agency that is then passed down into services, and then not structuring the role or the training that people have. The NDIS market model, which is means that often support coordinators don't have people, allied health professionals or other people to refer people to or coordinate people with, and a lack of stewardship to ensure that people are getting the supports that they need in the context of their lives. So that means that stewardship means like the ability of the agency to ensure that the people who need supports are getting the supports no matter where they live or what their needs are. So those types of things mean that the same issues that have plagued support coordination and recovery coaching is still going to happen in the psychosocial recovery navigator role. So if we put people at the heart of mental health support, well, what do they want? They want an ecosystem of supports. They don't just want one area, they just don't want one area in their lives being supported. And an ecosystem, it's a bit of a buzzword, but I think it's an important sort of idea in that it helps, you think about an ecosystem being unique, it's an interreliant system. Every part has a role to play in its success, and it changes and adapts. So this is sort of a really basic guide to what a psychosocial ecosystem sitting around an individual might include. So health system-based supports when people need them, psychosocial supports, and then we've framed this as the foundational supports that have been discussed also under the NDIS review and sitting outside the NDIS. Specialist supports such as NDIS supports or other things such as HASI and other types of approaches. A supportive community that people live in, so that's about thinking about the community, and then mainstream supports that understand the needs of people with psychosocial disability. We've put that together as part of a much more complex diagram, and I'm not going to explain this to you, so just a warning before you get to the next slide. So don't even attempt to read it. But what we're trying to do is to think about what are the details that we need within this element of foundational psychosocial supports that sit outside of the NDIS. And as I said, I've got some more information about that model that I'm able to give you as well in this today. But I'm not going to explain it now. But I will show you that actually up the top here, we have navigator is really, really important as part of what sits outside of the NDIS. So the navigator is important, and this is this research. Our research has developed this, has brought together lots and lots of different areas of work to truly define what is needed in a navigator. So really, it's at the heart of a recovery-oriented relationship between an individual and the system, but the relationship is core. It's a relationship where someone is understood, and it's a relationship that connects people to services and provides limited interventions, such as, working with a wellness recovery action plan, for example. It's been identified as the most essential element of systems, and is really this key mediator between individual and supports. It should be provided to everyone that needs supports, and the intensity of that relationship should be individualized. It's really essential that people who have that role have an understanding of mental illness, either through training and experience, including lived experience, but training needs to be part of that. And it must be embedded in a team and support structure that can provide both supervision and a knowledge network that enables effective coordination and understanding of what works. So I'm going to end my presentation there because I haven't had much time. I've probably even gone over it a bit, but I wanted to, just open it up for questions, or maybe I'm not sure what the process is now, Bill, but I'll pass back over to you.
Yeah, thanks, Jen. I'm happy if anyone has one or two questions that we can fill now. Are you able to stay, Jen, till the end of the presentation, and then there may be
Absolutely.
more? Okay, perfect. I'm happy to send if anyone wants to send a quick question. We can answer at least one or two questions, and then I'm happy to pass over to Evelyne. Yeah,
Simon's got his hand up.
Simon, if you can ask the question, please.
Hi, I was just wondering did you look at if when support coordination worked well? Because we've got a really good support coordinator, and when that works well, I think there'd be a lot of learnings from that when support coordination with psychosocial supports works well. I was just wondering if you'd looked at that.
Yeah, so
Thanks, Simon.
there's some good literature that looks at support coordination that works well. And I think it's really people often focus on where it's not working well because they want improvements in the system. And that's one of the problems with some data collection, in that people focus on what's not working well. But there is good research that shows where it does work well, and we've tried to draw on that to look at the elements of what works well. They are the ability for a relationship to develop, where the support coordinator really understands the context of the person's life and the community in which they sit and what their goals are. And the sort of a localization of that. So I think that is really seems to be at the heart of it, is a strong relationship. Yeah.
Thanks, Jen. I do know that there's a few other questions come in. We'll try and attempt to end at those at the end. But for now, thank you very much, Jen. There will be some room for us to talk or us to ask some questions for each of the speakers at the end. So without further ado, can I hand over to Evelyne? Evelyne, if you're there, could I kindly ask you to present from a sector perspective?
Good morning. Thank you, Bill. I appreciate the opportunity to present. Let me start by acknowledging country. In the spirit of reconciliation, I acknowledge the traditional owners of the land on which we meet today. I'm on the land of the Cabrogal clan of the Darug Nation. I also acknowledge that this land was accessed by people of the Dharawal Nation, and I pay my respects to their elders, both past, present and emerging, for they hold the memories, the culture and the dreams of the Aboriginal and Torres Strait Islander people. I also acknowledge that the Uluru Statement of the Heart humbly remains an open invitation to support closing the gap. I also just take this opportunity to recognise those with lived and living experience in mental health challenges, their advocates and allies, and your experiences continue to inform the work that we do. And I also extend my empathy and understanding to those who remain private and silent about their mental health challenges. So I thought I would start off today just first of all talking a little bit about who the Mental Health Coordinating Council is. So we are the peak for primarily for community managed organisations across New South Wales. We support with policy leadership, advice on legislative reform and systemic change, and we're also a registered training organisation, which I'll talk a little bit about shortly. There's a lot of information in this presentation. These slides will be shared after the presentation. I wanted to just draw your attention to the myriad of reforms that are happening across the state and nation. I won't have time to go through them all clearly, but just the first one here on the left-hand side under national identified that there was 500,000 unmet psychosocial support needs outside of the NDIS with people with moderate and severe mental health challenges. So I think it's important just to hold that in mind as I go through the rest of this presentation. Mental Health Coordinating Council has a myriad of resources available on its website. That's just a quick snapshot to give you some visibility to them. They're easily accessible through our website. I was pleased to hear Jen talk about peer navigators. As a registered training organisation, we deliver accredited and non-accredited training programs. Yesterday, we just launched 10 years of delivering the mental health peer work, and the QR code that will take you to a video and a commemorative booklet. But what I was happy to hear Jen talk about was the mental health peer navigator role. We're really pleased that we have developed a new nationally accredited mental health peer navigator that's been approved by the national regulator. So it's already available and the course is already running. So again, I encourage you to look at our website for information about that. There's a whole bunch of other training programs that we also deliver. One thing I wanted to just flag here is that we also take responsibility for something called the Community Mental Health Drug and Alcohol Research Network. If you use that QR code, it'll take you to information that's available for the sector, because the intersections between mental health and drug and alcohol use is very well known. So the key focus that I've been asked to work on or present on is foundational supports. So I think it's important just to go back a step, and I apologise to those of you who are already very well across this, but the NDIS review recommended reorienting the scheme with a redesigned disability support system. We're all very familiar with the fact that there were 26 recommendations with 139 actions, and the whole concept of interconnected reform package was highlighted. So what is the challenge? Jen also touched on this, so I'll try not to repeat what Jen's already presented on. It was always intended, the NDIS was always intended for those with severe and high complex needs. And what the review commissioners heard was that services supports do not exist or are hard to find, leaving people without support. And I'd have to say I'm a carer and a nominee for my mother who's an NDIS participant, and for those inside the scheme and for those outside the scheme, there's a myriad of complexity in terms of accessibility and the right supports for the right need, and also in the right location. So localized supports remains a forever existing challenge. And as a result of not having the right supports in the right place for the right person, or the right supports for the person, the scheme has just had so much more pressure put on it. So clearly something needed to change. I thought it was important to just reflect on the contemporary relevance of psychosocial supports. So government has so far invested 5.8 billion, and that's around 45% of the projected combined government expenditure in mental illness of 12 billion. Government interest in foundational supports for people with psychosocial disability will be significant focus for governments, and later on I'll talk about what the 4 key priorities are for government. More discussion about psychosocial disability in governance. Clearly, as I mentioned earlier, there was 500,000 unmet need, and so there's more of a focus on, well, what are we going to do with this 500,000 unmet need outside the NDIS, let alone those that are in the NDIS. And then the policy debates and the intersections between mental health, housing, employment continue to garner interest. So the key findings from the NDIS review, that we need to have the navigator roles, as Jen referred to, that they should improve and expand current programs and activities as funded through the ILC. And then this concept of general and targeted supports, which I'll talk about in this slide here. So this is a diagrammatical explanation of the current state and the future state. So the current state has the tier 1, tier 2. There was a clear support gap that was identified, and then the tier 3. And what they want to move to, or are moving to, is that mainstream services and supports, community supports, is maximised and is improved, and that's for all Australians. Then you have this purple bit here, which is the split between the general supports for all people with a disability under 65, so it's circa 2.5 million. The targeted support will then focus on people outside the NDIS, so that would be trying to support the 500,000 unmet need that the Commonwealth report identified late last year. And then you have the NDIS individualised support. So you'll see less people entering the scheme, and we've already started to see that, and Jen has just introduced some of the data around how less people are getting into the NDIS with the hope that this foundational supports will support them. But of course, the conundrum that we're in is that that's not built yet, and in the meantime, people's needs remain unmet. This is another way of describing it, but this comes from people with a disability, but I've just added this on the right-hand side, which is the early intervention supports. So there's another concept called the early intervention supports, which is supposed to sit between foundational supports and getting access to the NDIS, and it's called early intervention at this point. And that's supposed to support people for 3 years to assess whether or not they're eligible for the NDIS. So it's like a stepping stone into the NDIS, but with the hope that people who enter into early intervention can be redirected to foundational supports. So defining foundational supports, I know that Jen presented the ecosystem in terms of Sydney University's explanation of it. This is what's been presented by the Physical Disability Council of New South Wales. So mainstream services, you're looking at the systems that we all access: education, health, employment, housing, and making sure that those mainstream services are better accessible for people with psychosocial support needs. Under general foundational supports, it's about providing assistance to navigate the support system. That's where the role of navigators come in. Information, advice, referral, peer support, advocacy for individuals, families, and communities. Under targeted support, they're talking about home and community supports, personal assistance, early supports for children, targeted supports for adolescents, and then individual supports, which is under the NDIS budget. So I mentioned before that there were 4 key cohorts that the NDIS final report mentioned that it wanted to focus on. The first one is the children with disability or developmental concerns. This is the thriving kids. Adolescents and young adults aged 9 to 21, people with a psychosocial disability, which is what we're largely all here focusing on today, and then First Nations people with a disability. I'm not going to spend too much time talking about thriving kids. As I said, these slides will be available for you to read later, and I think there's been enough about thriving kids for people to grasp the focus areas there. What I wanted to talk about next was just what's happening in government at the moment. So National Cabinet has so far agreed to jointly design foundational supports for people with disability, commissioned by the Commonwealth and state and territories and delivered through existing mainstream settings where appropriate. Fund foundational supports. This is a little bit tricky. This is where we talk about the cost sharing of 50-50. Whilst there was commitment around it, I think it's all now caught up in the National Health Agreement and the negotiations as it relates to hospital funding, etc. So everyone's playing politics, but people's lives are at hand, and it's really important. And we're certainly advocating for bipartisan agreement and to move this along quickly and not kick the can down the road even further. Understand that hospital systems obviously need to be funded and supported, but in the meantime, people with psychosocial support needs need to have their needs addressed. Lives are dependent on it, as I said. Implement legislative changes to the NDIS Act, and then adjust the state and territory NDIS contribution escalation rates. That's economics that I will stay out of. Current priorities, the Cabinet Office is leading the policy design for the development of the foundational support system and jurisdictional negotiations. We are regularly meeting, and I have been for over a year now, with New South Wales Health and DCJ, the Department of Communities and Justice, because DCJ is the lead on this under Minister Washington. So we meet with our colleagues in health and NDIS, the National Disability Service. We meet, I think it's bi-monthly, just to keep talking about what do we propose the system needs to include, and not wait until funding is announced and then build the system. We're trying to fly the plane while build the plane, so that we just get services delivered and out there as quickly as possible. But I'd have to say, as you saw in the 4 priority areas, it's thriving kids is obviously the priority right now. Early intervention pathways, NDI leading the policy design, access eligibility review pathways need to be developed. A suite of supports to be available to people is unclear what will be in scope. And legislation changes that I mentioned in the previous slide. So the Intergovernmental Working Group has held foundational supports workshops. I have attended those through Mental Health Australia and the work that they're doing through the Mental Health Australia Psychosocial Network Group. There was some workshops held there. They're trying to define the scope of foundational supports. They're talking about a staged release of data and what the funding parameters should look like, and roles and responsibilities in terms of governments. The Ministry of Health, and Vince Ponzio is leading that in the Ministry of Health, is contributing to New South Wales discussions on the design, ensuring the integrity and quality in the delivery of the health service obligations is maintained, opportunities to strengthen and build on existing services where appropriate or are appropriate utilised, and new supports and services must be based on best practice principles, which I'll talk about maybe in the Q&A if we have time, and effective management of the workforce challenges. MHCC has done a significant amount of work in the workforce space, and you can see our workforce profile report on our website. But we're growing exponentially. We make up 1/4 of the mental health workforce in New South Wales, so there needs to be investment in the workforce. You can't just have all these wonderful programs without the appropriate workforce. So what are some of the next steps? The federal government, as I said, they're doing the early modelling and planning underway, and it's very limited information coming through in terms of what is happening in there. Workforce and sector capacity. I sit on the National Mental Health Workforce Advisory, I think it's called a working group. So trying to feed into the advisory group at a national level, again, just to keep prioritising the needs of the workforce. The mental health branch, so in the New South Wales Ministry of Health, what they're doing is working with the state and federal government colleagues to seek clarity and agreement on funding implementation of foundational supports. Engage with mental health services. As I said, we're meeting bi-monthly with Ministry of Health and other representative stakeholders to design and build the disability health system. And MHCC, I've already mentioned that we do the bi-monthly meeting. We will be releasing a position statement with the NDS before the end of the year that just talks a little bit about what we think the system needs to include. And I can talk maybe a little bit about that in the Q&A. And the last thing, it's a plug from me just to say that we do have a weekly newsletter that goes out. If you're not already signed up to it, I encourage you to do so. It's free and you can subscribe at our website at mhcc.org.au. And if you're not already a member and would like to be a member of MHCC to stay abreast of everything that's happening, you are more than welcome to join our organisation as a member. Thank you so much, Bill.
Thank you, Evelyne. Well, you had a bit of time up your sleeve. You could still. On that note, thank you so much for providing a very, I suppose, extensive overview of what's happening in the sector, particularly with all the moving parts around different policies and different government departments, how they interact, and obviously then how that translates through to programming services and organisations like ICLA. So we do have time for about 5 or 10 minutes for us any questions. If anyone, I do know that the chat room is actually filling with different lots of questions, but are there any specific questions that people might want to ask Evelyne directly? We'll have some time for some questions now. If you could put your hand up, I'm happy to field some of those questions now.
If there's no questions, Bill, I might use the time just to quickly talk about what we think the system should include. Is that helpful, or should I leave it for the Q&A?
Sure. No, I've got a few questions of my own if you like, but if you go ahead and express what you're hoping to give.
Sure. So I
Yeah.
guess what we will include in our statement later in the year is just what we see is needed, and it's not too dissimilar to what we've already spoken about between Jen's presentation and mine.
Mm.
It's general navigation and capacity building. So we need information, advice, and referral services. So information hubs, directories, access to face-to-face assistance, service navigation. We've spoken a fair bit about that already. Social and community connection. I think that is so important. We talk about needing a sense of belonging. We talk about loneliness. So social and community connection is always going to be paramount for everyone in the community, but more so for people with psychosocial support needs. Outreach and engagement is going to be important. That's culturally and inclusive, culturally safe and inclusive engagement. And under targeted supports, we would be talking about daily living support, accommodation, education, employment, supported decision making, and peer workforce engagement. And our practice approach is not too dissimilar to how we already deliver the myriad of mental health service programs that we deliver across the state, trauma-informed and recovery-oriented, human rights focused. And again, I emphasise supported decision making. That's all I wanted to share. Thanks, Bill.
Thanks, Evelyne. I think there is a quick question in the chat room here, which is associated with is a mental health coordinating council addressing the huge disparity between mental health services in the metro New South Wales area and the regional and rural areas. So if you'll answer that one, and also I noticed that Nicola has a hand up, and we'll go through that question in a minute.
Yeah, thanks, Meredith. It's such an important question and something that needs to continue to be addressed. The one immediate way that I know it's being addressed, and it's a live one, is the Community Living Supports Program. Used to be known as the HASI program, but from the 1st of July next year will be referred to as the Community Living Supports Program. That's went out to tender. I think it closed last Friday. The department did a complete rejig of the allocation, particularly taking into account regional New South Wales. 10 years ago, Hunter New England was leading the way through the NDIS and the pilot program, and so community living supports wasn't quite significant there. And then through the reanalysis and the replanning, they've had to put more investment into regional New South Wales. So there are some elements of it, but there's so much more that needs to be done. There's a need for the overall overarching ecosystem to have more significant investment in it. But I hear what you're saying, and it's something that we just keep trying to advocate for all those priority populations. It's really important that we keep having the conversation. Thanks, Bill.
Thank you. Nicola, you have a question?
Yeah, hi. Look, thank you. Evelyne, I just wanted to understand from your perspective, like I've been trying to imagine what foundational supports might look like from a person, say it was myself walking in the door, seeking support with my mental health issues, if I was a participant or a consumer. And given that the foundational supports is going to have, a general be available to all people with disability in the Australian community, and then targeted supports with at this point, four key distinct target groups, how do you imagine that the navigators, or how do you imagine that's going to be effectively set up to fixing the gap for people with psychosocial support needs?
I think it's a good question, Nicola, and I think I always have in my mind this very organised system where from prenatal right through to aged care, anyone can access a support system wherever they want to at whatever point they need it, rather than trying to figure out where the support is. So that's the vision. In terms of how it will actually work, general supports I think should be easier, because that's where you're going to have all these peer navigators pop up. It's a bit like customer service New South Wales. When you go in through the front door, you've got someone there all ready to greet you, to redirect and punch the right number for you if you're getting a driver's license, or if you've got to pay a fine, or whatever the case might be. So I think the navigators will be easier. The targeted supports, I can't help but wonder whether or not people who enter the NDIS, who apply for the NDIS, who don't get in, whether they'll just be pushed back out to targeted foundational support. So you've seen the stats that Jen presented. I think we're up to 23% only accessing the scheme at the moment. So that cohort that's not accessing it, whether you would hope that if they're not accessing it, that the system will just push them out to targeted foundational supports. But then, of course, we know the population that exists that will be able to enter through targeted foundational supports without needing to get into the NDIS. So there's a huge role that targeted foundational supports will play, and that's where the 50-50 investment needs to come into play. But yeah, that's it's a good question. I don't have all the answers, but I have the hopes and the vision for what it might look like, which might not account for very much.
Yeah,
but
thank
anyway,
you.
thanks, Nicola.
Thanks, Nicola, and thanks, Evelyne. There is a quick comment here from Helen also in the chat regarding discussions with the Ministry of Health, because obviously there is a number of people coming in and out of the health system who are acutely unwell. And so, are there some discussions or mandates to support people with mental health services that can be provided, particularly when you want to avoid people going through to an admission? Any comments, Evelyne?
Look, there are a lot of comments I could make. What I was going to try and quickly bring up, if I can, actually, if you bear with me. One thing that I'm trying to promote quite actively is what we do really well in the community managed sector. I'm just going to quickly share my screen. I promise I'll only take 2 minutes, but I think it's a good one to... So what we're trying to do is promote the evidence base of the community managed sector and what they do. Am I sharing my screen, Bill?
Not yet, no.
Not yet. Share. Okay, so what we're trying to do is lift the voice of the community managed sector and what we're doing really well there. And you'll be pleased, Bill, to see that ICLA's recent review is there. ICLA, for instance, PARC costs, Prevention and Recovery Centre costs a third of inpatient care and reduces ED visits by 33 to 44%. Flourish's Resolve program cut hospital admissions by 54%. And time in hospital by 66%. And then CLS dropped admissions by 74% and decreased hospital stays by circa 75%. So I guess the reason I'm sharing that is because the bottleneck that exists in the emergency departments and in hospitals doesn't need to be there when we can front end and front load the support, prevention, early intervention, programs like those 3 that I've just shared. And Mental Health Australia has done an advice to governments, which was the first one on that slide. And that, it's evidence informed by good practice psychosocial support services. So there's some really great work that happens in community. I don't know that we can, the hospital component and admissions component, I just think flip the switch and reinvest in early intervention, prevention, and community managed programs that deal with and support high complex clients with great success, I guess.
Thank you, Evelyne. It's a really insightful, and obviously there's a lot of great work, not just at the Mental Health Coordinating Council, but obviously also from Jen as well, in terms of really advocating for this cohort, or for the people with complex mental health needs. That kind of concludes, and I suppose the key aspects of our presentation. Thank you for all those who are attending. I am going to open up. We have literally time for about 1 or 2 questions, and I also have noticed briefly that the chat room is going, enormous amount of discussions happening in the chat room. We'll capture that. We got Christina and Renita, who's part of ICLA, who was trying to capture some of that discussions on our chat room. And so we will distribute this recording as well as addressing some of those questions afterwards. So I'd just like to open up the floor just for any questions to any of the speakers at this moment. So we have time for probably two questions, and then I'll wrap up and speak a little bit about what we're hoping to do in future sessions and future webinars. Any questions at this moment that people might want to go? Yeah, Lindsay, you've got your question, your hands up. We can't hear you, Lindsay.
Oh, there we go. Can you hear me?
Yes.
Got it. Sorry about that. My bad. Look, so my question is really, I mean, I had a question earlier on, which sort of just said, Me questioning why we need to have foundational supports. Why aren't we potentially just advocating for sort of revised eligibility guidelines and adequate funding for people just to access the NDIS? That would be the first one. The second question would be, is the government committed to foundational supports? Definitely, and is there a timeline for development and implementation?
Good, great questions. I mean, I think the first question may be directed to possibly either Jen or Evelyne, but Jen, can I ask you to
Yeah,
address
I
the
think
first question?
I'll just answer the first question quickly. I think that the NDIS is too restrictive, so I don't think it offers enough supports, and I think that the framework in which it operates in, it does not enable us to have the values that we want in the mental health system, because it's a very restrictive focus in terms of what's provided to people.
Deficits
And
focus.
yeah, it's a deficit focus. You have to prove how bad your mental health is in order to get access, rather than where you're going and your goals and that type of thing. So I think that's probably just my quick comment about the NDIS. Hasn't really lived up to expectations, and it's making mental health challenges fit in with a completely different approach, I feel.
Yep. Thank you.
Evelyne, do you want to just the second part of the question?
I forgot the second part of the question. The first part I was happy to answer, just to say that the NDIS at the moment is projected to cost $52.3 billion. And I think Medicare is far less. And so it's just an unsustainable system. But sorry, Lindsay, what was the second part of the question?
It was just basically around whether foundational support, whether the government actually has a firm commitment to that, and if so, is there any sort of time frame for implementation, or is it still a thought bubble to be debated? Is it going to happen, and is there a time frame?
Yes, great questions. I would say yes, it's going to happen. In terms of timeframes, Thriving Kids is the priority. We keep hearing about 1st of July next year for Thriving Kids. So I don't know how they're going to get things done in the next 8 months. And then timeframes are not clear, is what I would say for foundational supports, which is what I keep saying, that we've got all this unmet need and the bottleneck within the systems of people being unsupported. And in the meantime, you've got these people that are unsupported while they're building this system. So no timeframes for psychosocial, but I know Thriving Kids is supposed to start from the 1st of July. They probably will look to expand ILC as well in the meantime.
Yep. Okay.
Thanks for that. Corinne, you got a question? You there, Corinne?
Sorry about that. Hi, everybody. Thanks for that. And thanks very much for all the presentations. I just wanted to raise the issue of concerns about duplicating the bureaucracy of the NDIS through foundational supports. I'm just concerned that we're going to end up spending an awful lot of money on a bureaucracy and not enough money on the services. And just in relation to the person who was asking the questions earlier, is there not a way of looking at the existing system and seeing whether there can be some quality improvement to have another part of that, rather than, it's just a question. I'm not saying that's what I want. I'm just raising it as an issue. Thanks.
I'm happy to address that question, Corinne. Yes, there's always a risk whenever government changes direction, particularly around policy or structures, that a large amount of those resources will be taken up through the operations, design, and administration. I think the government is aware of that, at least the current government, federally and probably state, because obviously we're in a very fiscal economic environment. So the last thing they want to do is to spend money where they don't need to spend money. So that I think in some ways will happen. I guess one of the things that I think the government is looking to really address is the partly around the navigation role, which I think is something that's underserviced. It's a matter of actually engaging the direction of service based on the least path of resistance where people can get access to. So that if a government can look at the system that's making more efficient and more transient in ability for people to see and see where those services are, I think that's probably where the government will look to invest a little bit more on. We talked a bit about foundational support, but we also talked quite a bit about navigation, which is something I think the government is seeing that as a way of creating those efficiencies that they need in the government to obviously allow people to access the services that they need. I'm happy. I have to say, I want to say, firstly of all, thank you for everyone for attending. But more importantly, I also want to thank you very much for Jennifer, Evelyne, as well as Jackie, for each of your perspectives in this talk. It is, in my mind, as an ICLA, as a service provider, these insights are critically important for us to understand how the system is changing and importantly, how it translates on the ground. So Jackie, I would just want to say a special thank you for your personal story, which I think has given enormous insights to. We talk a lot about what's happening at the helicopter view, how things changing, but it's really important to understand what happens on the ground with those people who essentially have to carry that journey of care at a very intimate level. So I want to say a special thank you to Jackie. In terms of where we go from here, we're overwhelmed with interest in this webinar. I think in some ways, particularly as ICLA works in the space, we see this as a way of also opening up discussions within the sector as well as the community. We will venture into additional webinars, possibly not in the end of this year, but early next year, where we start to see and uncover different changes in the sector. And I think what we want to do is, as ICLA, trying to understand and be on the front foot of those things and share that with the community and the people that we support. So I want to say thank you again to all the people who have participated. Thank you also to my staff who has done a wonderful job in not only promoting this, but also coordinating this event. I won't name them all individually, but there's a great team behind me that has not only supported in developing these webinars, but also creating the space for us to have the speakers, as well as coordinating the social media engine room that allows people to understand and be invited to come and attend. So at this stage, the only thing I will say, and there was an important point here, ICLA is also looking at different parts of the services. I like to see ourselves as an innovator in the psychosocial and complex mental health service delivery. And one of the things that I think really highlighted the way we're developing our services at ICLA, with obviously the restrictions of funding, but we also see a great need for the in-home support. So this is something we are launching. Jackie made a quick comment, which I think related to how we're developing our services, is when people who have someone with a complex mental health needs living in the home, but instead of having them to leave the home and go on holidays, that the family could go on holidays and the person who has those needs can be supported in the home. And that's one of the things that I think prompted ICLA to start looking at more services around in the home and to develop those abilities to actually support people in the homes. So please feel free to reach out if you wanted to get any additional services or additional information about ICLA. For now, I wish everyone a safe and happy, I understand in Sydney at the moment, we're going to hit a scorcher of 38 degrees. So wherever you might be, I hope if you're in Sydney, to stay cool, and for the rest of you to have a wonderful day, and we'll be in touch with a newsletter and some details after this event with future events. So thank you very much, everybody.